But I would like to start by saying that we haven't had any student cases, and I think that that's a very positive thing. We have had adult cases within the schools, and some of those decisions have impacted other people who we have determined are close contact. But we have not had any outbreaks. I mean, if we have an outbreak, and that just means, that one positive case we can link directly to another positive case or more, we would need to look at closing that school down or whatever period of time to clean, to mitigate, to do all those things that we need to do. But we haven't been there. That we needed to think about that, and I think that's because we've taken this very, very seriously. I think it's because we have excellent mitigation expectations in place. I think that we're overly cautious. I say that a lot of times in administrative meetings. There's cautious, there's overly cautious, and then sometimes I feel like where we are is we're overly cautious. And I think that's resulted in lower incidents, what I consider pretty low incidents. If the community wants to look at our dashboard on our website, we keep the information right there. So folks can look at, the number of students who are positive, the number of students who are quarantined. Same thing with staff, the number positive and the number quarantined. I think those numbers are very low. But to answer Dr. Catlett's question, when we hear of a positive case, that we immediately contact the health department and we immediately begin contact tracing. That we find out where that person was, when were they in the building last, when were they symptomatic, who were they in contact with. We ask a lot of questions. We review all of that information with the health department, and then we make determinations on how we keep folks safe, and how we quarantine or how we isolate. I will say that folks probably saw that the CDC recommended lowering their 14-day quarantine last week. The Virginia Health Department came out with, the Department of Education came out with a summary memo that just said that 14-day could be reduced to 10 or even 7. I can tell you that we met this morning, first thing, 8 o'clock this morning, and we determined that is not good for our community, that all that's going to do is spread COVID at a faster rate. I understand what they're trying to do, but we can't support that. Our moving forward is going to stay to 14-day quarantine. We want to make sure that COVID, when we isolate or we quarantine someone, that is not coming back into our building. Late this afternoon, I did receive an email. All school divisions in this area received the same email from the health department, and that email said that they cannot support that 7 or 10 day lowered quarantine. It's just not good. I don't think it's a smart decision. So part of our process is always working hand in hand with the health department, and then moving forward with good decisions. And there are a lot of things that we do that folks, they just don't see. I spent the better part of my Sunday investigating two events. And part of my work on Sunday was to ensure that classrooms were being sanitized. And that was either happening late Sunday afternoon or it was happening at 6 a.m. In the morning when no one is there. But we wanted to make sure our buildings are safe for our children and for our employees. So a lot of things that we're doing are happening outside of hours, but they're always to make sure that our kids are safe. But Mr. Bailey, I don't know if I answered your question. but it's a very detailed process, and we take it very seriously, and we involve a lot of people.
You did answer my question, and that's why I asked it, because I think your description of the process, I could feel a sigh of relief from citizens in our community knowing what it is. I mean, it was kind of an alley-oop for you, but me working in the system, I know what frustrates people, and I know not knowing what we do is part of the issue. And the fact that you so eloquently and in such detail described what it is we already do and the processes that we will use when something happens, you nailed it. And that's what people need to know. That's what reassures them. And so, yes, you answered my question. Thank you.
And we'll certainly continue to build on that as we bring more students back as well.